The Title V Maternal and Child Health Block Grant works to improve the health of more than 42 million mothers and children nationwide. That's about half of all pregnant women and a third of all infants and children in the United States. Now, let's hear from a few families whose lives have been touched by Title V.
He was identified at 2.5 with bilateral progressive hearing loss. And we're on the reservation, and services on the reservation are very limited. And lo and behold, we were, hooked up to our Title V services that's located in Cibola County, and they were able to network other services for him so that he was able to get the hearing aids. He was able to get other equipment that went with his hearing aids.
It was a huge help to our family, that Title V was there to help my mom, get the services that my brother needed. It helped him go to school. It helped him, to hear and understand what was going on in class.
My wife tells the story, but she was reading the What to Expect When You're Expecting book and all the things that you should be expecting when you're expecting, and wasn't getting the kicks that she thought she should be getting, and so went in to just do a routine check, and they did an ultrasound and started to identify, her feet, her hands, and then stopped talking and saw the doctor, and the doctor said, well, it looks like could be a neural tube defect, but the only way I can do this if we do amniocentesis. And we just stood around there with the doctor and everybody else, and we said, now what? I mean, there was the now what. And then we were put in touch with a specialty, child health specialty clinics, which is, of course, a Title V funded program, early intervention program, which has a collaboration with Title V, Early Intervention Part C. Title V pays for programs that allow families, an opportunity to understand, what they need.
Some people don't have, family and other people that can help. So it's when one of the workers actually went to an ultrasound with me, which, I didn't ask, but I think I was kind of leading towards I didn't have anybody to go with me. And so she said that she would be, happy to go with me. And she did. And finally, when I did have the baby, no one was there to be in the birth with me. And she also offered her help with that too. So she was there for the delivery as well. I really felt like, okay, it was another person trying to get in my business and really wasn't there to help. But as I started talking to her and, opening up more, I felt that she really was genuinely concerned about my situation. And then I started to open up.